My name is Matt Emhoff, and I'm giving a few of my thoughts on a case study um, about domestic violence. So, our case study is with Martha. She's a 35-year-old Hispanic mother of six children, and they range from 4 months to 16 years of age. She also lives with her brother, his wife, and their infant. So, it's a full household. Um, Uh, Martha and her children were victims of um, domestic violence from her boyfriend. Her boyfriend tried to hit her with a baseball bat when Martha was pregnant. Martha gave birth to a premature infant because she was on methamphetamines. Um, she has conflicted relationships with extended family members. Um, her uh, her daughters that are in middle school and high school have been in fights, running away from home, just a lot of different things going on. Um, Also, Martha has been charged with child neglect in three other cases with her children due to lack of supervision. Yeah. So Martha was referred to treatment. Martha talked about a history of just a lot of stressors, a lot of influences, um, an unsupportive family, other domestic violence, her younger brother having committed suicide, just a lot of traumatic events in her past. Um, she talked about herself being very dependent on male figures and doesn't really have the assertiveness to deal with men and to be strong for herself and her kids. Um, Also, the methamphetamines, affect her judgment, affect her ability to communicate, affect her ability to be present and aware, and she doesn't have as much interest in the family, and she's lost jobs because of that. So that's a really big issue as well. So the treatment that's set up for her was started with a bunch of different tests done by professionals that just kind of help her understand, help the therapist understand where she's at. And they did this 1 week prior to treatment, then 6 months after, and 4 months after the treatment completion. Um, so during therapy, um, the main therapy used was family behavior therapy. And some of the things that were applied from family behavior therapy behavior goals. So the therapist sits with the client and they write out goals. What do you want to do? How do you want to act from here on in? Some smaller steps to say this is what we're going to do. This is what we're going to achieve. And then you write it down on a document and the client signs it, and then every week you check in on those goals and see how you're doing, see what's going on, and those are focused on the drug use, focused on communication with the kids, positive reinforcement, things like that. Stimulus control, the environments and situations that lead to a greater risk of the drug use, especially the greater risk of violence um, or danger to the kids or danger to her. These things. So the therapist and the client sit down and say, these are the environments that lead to these consequences. So how do we stay away from those, and how do we help you get involved in situations and environments that are positive towards you and your family, that are healthy, that are safe towards you. Um, Self control, just helping the family to recognize the triggers. So, not just the environments, but also the triggers, the moods, the frustrations that lead to the drug use or violence or that kind of thing. Um, one thing the therapist used was the assurance of basic necessities and safety worksheet, which teaches the family all together, to just look at the home and see the things that are needed, see the things that are safe and the things that are unsafe, and to help each other build a safe home. Um, Communication skills, just working on communicating positives, communicating your desires, communicating your expectations and assumptions, all these things. Um, Child management skills. Child management skills. This woman is a mother of 6 children, and uh, and in therapy, she's learning how to how to speak to her children, how to ask questions, how to be present, how to set good boundaries, healthy boundaries, and consequences if those boundaries, if the kids go past those boundaries. She's learning financial management, how to set a budget, how to manage the money, what to spend on, what not to spend on, these kind of things. Financial troubles are a big part of this. Um, the therapist is assisting Martha in getting help, looking for jobs, going to job interviews, helping write a resume and a cover letter, those types of things. Um, and then they're using the integration of a healthy lifestyle curriculum with with the whole family, which focuses on healthy dieting and physical activity, um, and which puts into practice things like eating meals as a family, taking walks, um, sports, running around outside, board games, game night, just things to interact as a family in a positive way. The family received 20 treatment sessions in 6 months, each lasting between 90 minutes and 2 hours. And they did this once or twice a week. Um, Most of the kids were there at all the sessions, so it was very family oriented, which I really like. I think it's really good to have the whole family there when there's a family crisis, and the violence happened when the whole family was there, so that the kids and the mother can all work together and learn together, and get therapy together. Um, During the therapy, some positive responses were that they were able to set healthy goals, for both Martha and the children, to learn to live healthier, better lives. Um, she These goals were affecting the communication between the mother and the children, establishing a routine as a family. Martha enrolled in college. She obtained a driver's license. Um, she got she figured out transportation for her and her kids. Um, they created a safer home. All these goals that were met. The other thing that they did in the therapy sessions was, as a family, they practiced just positive interaction with each other, and they said that that was very helpful just to learn how to talk to each other. And the kids noticed actually that pretty quickly the mother was less angry. She didn't shout at them as much. She listened better. All positive things. Overall, by the data that was collected, Martha improved in most of the domains that they were assessing. She was found to have a lower potential for child abuse. Um, Her family relationships were better, or improving, and she herself reported more satisfaction, just in her everyday life. So it seems like this family, Martha and her family, are heading in the right direction. Um, and I hope they're doing okay today. So, my overall reaction is, first of all, it just strikes me that um, it's pretty complicated. There's not just one issue. Uh, this is multiple traumatic events happening first to Martha in her childhood, growing up, her brother committing suicide, just all those things. And then as an adult with children, her boyfriend is attacking her with a bat. So there's just a lot going on. It's not just one thing. Um, it's not very simple. It's all entangled. It's all a part of her story and her decisions and what led to where she's at today, which makes the job of the therapist a lot more difficult. Um, and it can be done. And I think it's really, really good that um, they did the family therapy and they went through that as a family with the kids, with her, and that kind of thing. She was eventually diagnosed with current amphetamines abuse, um, and you could kind of see where I mean there was no proof of this in the article in the case study itself. I would need more information for actual diagnosis, but it seems like there could possibly be generalized um, anxiety disorder or a stress disorder for the kids or for Martha, and that the kids are running away from home, they're getting in fights at school, um, so there's just a lot more going on, and there's probably multiple diagnoses um, that needs to be happening for both Martha and the kids. The boyfriend got uh, court ordered to stay away from the family, which I think is really good. So that's really helpful as well. Don't need that continuing. Um, so, um, like I said, I hope that they're continuing to do well today.